Joined once again by Dr. Syed Hussain, the Chief Medical Officer of Trinity Health of New England. Good to see you again, sir.
Likewise.
Yeah, glad to have you here. Let's start with the avian flu. It's caused, I think, about 58 million birds to be killed across farms across the U.S. Not really sure exactly how that relates to human problems and what a crossover potential they are, or what health concerns there are for us.
Yeah, so right now, I don't want folks to get alarmed or overtly concerned about this. We have to keep a close eye on H5N1. We've seen this strain before in previous years, Tim. What's different is just the sheer number of birds that are being impacted, both wild and domestic birds, like you mentioned. 58 million birds that have either we've lost or had to be killed to prevent further spread in the U.S. alone. Now, what's concerning, though, is there has been some bird-to-mammal transmission that we've seen in Spain, for instance, with mink, or in Peru with sea lions. So far, though, there's no human-to-human transmission, because we know it doesn't replicate easily in humans, but it needs a few more mutations to be able to do that. That's why I say we need to keep a close eye on it.
You always have to do in virology. That's how it works. Speaking of viruses, this was the year a lot of people learned about RSV, respiratory syncytial virus. Looks like there's a vaccine on the way. Might be approved by August, or at least authorized. How is that going to work? How would it impact not just infants, but also maybe pregnant mothers? I mean, when would they take it?
Yeah, so this is second to third trimester of an expectant mother, so that there's immunity that's passed on to the newborn and can last up to 6 months. This is the most critical period when it comes to newborns and getting impacted with RSV. We saw this play out over the last 6 months during fall and winter. So the initial results from the Pfizer clinical trial related to this vaccine candidate are promising. 82% decrease in terms of severe complications or disease in the newborn in the first 90 days. So FDA will be looking at this data. It's on an expedited approval pathway, and we expect some results to come by, some decisions to be made by the end of summer.
Also, remarkable news. Now, the fifth confirmed person to have been confirmed to have been cured of HIV infection. A man in Germany, I believe he was undergoing a stem cell transplant to treat cancer, and it wound up at least inhibiting the growth of the virus itself. What does that say for possible future uses for other people maybe who don't have cancer?
Yeah, this is very interesting indeed. I do have to mention here that the 5 cases so far that have been cured, individuals that have been cured from HIV, all have one thing in common, and that is stem cell transplant for blood cancer treatment. This is a pretty risky procedure with a number of risks, Tim, so I don't think we're there yet in terms of being able to offer this modality as treatment for all HIV positive individuals, but there's lessons learned and more scientific research that is needed to understand this better.
And by no means do we have all our eggs in that basket. It looks like there's already very good treatments out there to keep those HIV levels in people very low. Undetectable essentially means untransmissible. Like
absolutely. It's more like a chronic disease at this point compared to where we were 4 decades ago.
And thinking back to 4 decades ago, for those of us of a certain age, it's amazing how far we've come. And it just shows you how you can never take things for granted, that it's taken this long to get as far as we've gotten with HIV, to look what mRNA vaccines did against COVID in such a short amount of time. All right, Dr. Hussain, thank you so much for joining us again. He is certainly the expert. We enjoy his insights every single week.